So answer is repeated twice. And now I'm going to not play the audio here, but I want to tell you, I'll show you the script because playing audio it will take longer time. So I'll show you the script of listening part C, Chagas, to tell you reading and listening have all these types of questions and all these strategies or tips. Okay, Chagas, yes. And we will see this one. This is the script of one question. Okay, just we will read the question stem options and the first sentence.
4. Dr. Robson thinks the short-term priority in the fight against Chagas is to A. Increase efforts to eliminate the insects which carry the parasite. B. Produce medication in a form that is suitable for children. C. Design and manufacture a viable vaccine. Here is the script for this question. Plenty. Researchers are working on improved drugs to treat it, and a vaccine. None currently exists, but it
Okay,
takes...
we will stop here. So what is hedging word or keywords or phrases in the question stem? If there are beginners, this first line of the question is known as question stem. What is the keyword? Just type in the comment space, please. What is the hedging word? Short-term priority. In the first option, you are short-term priority and eliminate insects. Second one, produce medication. Third one,
Children. Manufacture, design, manufacture.
Manufacture vaccine.
manufacture vaccine. Okay. So main concepts here are vaccine, medication, insects. Okay. And first sentence, plenty. Researchers are working on improved drugs. Working on improved drugs to treat it. Do you have similarity to any option? Now this one, a medication in a form that is suitable for children. Improved drugs to treat it. What is improved drugs? Any connection with improved drugs in any of the options?
C.
Drugs means what? Drugs means what?
Vaccine.
Insects or vaccine or medication?
Vaccine.
Drugs means insects or medication or vaccine?
Medication.
Medication. So you have here medication, right? In a form that is suitable means improved. In a form that is suitable means what? Improved. Improve on the form, right?
Yes, Father.
So do you similarity here with this one?
Option B. Yes. Option B. Option B.
Option? Yeah, because it is similar.
Option
It is similar because improved drugs can never be connected with the insects or vaccine. Drugs is medicine, right? And then they say, and a vaccine, none currently exists, but takes at least 10 years. I don't want to go into those things. At least 10 years means, is it short term?
No.
No, Father.
No, it's not short term. It's not short term. See, the question says we are concerned about short term.
Short-term priority.
Short-term priority, yes. So at least 10 years. Imagine the patient is in the ICU. Immediately you need so many people with COVID-19 are in the ventilator and ICU. You need a immediate medication. So short term. Then another idea is to develop exercise drugs into tablets of different sizes. Develop different sizes. That is second one, in a form that is suitable for children. The same thing what is given in the topic sentence is explained. That is known as supporting sentence. That could and should be done almost overnight. Overnight, is it?
Short term.
Short term?
Short term.
Yes. Overtime and it is short term. Yes. Then next one more option is there about insects, right? Insecticides. Women said like those take decades rather than years. Takes decades. Is it short term?
No. Long term.
Long term. See, you can adopt any method. Topic sentence it is there. Otherwise, short term is the edging word. Short term priority, and just look into the time expressions. I am coming to that strategy later. That's why I'm not explaining that here. So easy and cool. Hope this is clear. See, researchers are working on improved drugs to treat it. Okay, so these are the two types of questions that we have, types of structure that we have seen. Okay, listening part C, let's check how it works. Okay, I'll be answering all your questions at YouTube. We'll just read first sentence. Let's check.
What impact does Dr. Skelton think the sprint trial will have in the future? Option A, it will lead to universally applicable guidelines for BP level. Option B, increased attention will be given to the effect of lifestyle on BR. Option C, GPS will adopt a more active approach to lowering BP in the elderly. It is interesting that a few GPs have already been working with older patients to hit lower blood pressure goals, and the new data will doubtless encourage greater take-up of this more interventionist line of attack.
Interventionist
So you want to
line
read
of-
full?
Yeah, enough. Yeah. What impact does Dr. Skelton think the sprint trial will have in the future? Okay, speculation. What are the heading words?
Name.
Impact.
Things.
Impact.
Impact.
Impact means.
But
Impact means
effect.
Effect.
effect. Okay. Okay. Now coming to the first option, it will lead to universally applicable guidelines for BP levels.
Universally applicable.
Careful guidelines. Okay.
Lines.
Yes. Then
Effect of lifestyle.
effect of lifestyle.
Lifestyle.
Yeah.
Lowering BP.
Lowering BP in the elderly.
Lowering BP in the elderly.
elderly.
BP in the elderly. In the topic sentence, do you have any similarity to any of these hedging words that we highlighted? This is the topic sentence, first sentence.
Option C for the
Older patients.
Option C. Older patients.
Older,
Patients.
working with
to hit
older
lower
patients. Yes.
Means
Elderly.
Yes,
elderly.
older patients. Yeah, elderly.
Elderly.
Synonymous. Synonymous. Okay, GPs will adopt a more active approach. It's interesting that a few GPs have already been working. Do you think there is a similarity? GPs will adopt more active approach. It's interesting that a few GPs have already been working. It's interesting, more active. They are really active. Okay, to hit lowering BP in the elderly, to hit lower blood pressure goals. Do you think they are same?
Yes, Father.
Yes.
Yes, Father.
Hitting lower blood pressure goals is as same as lowering BP.
BP.
Yes, same, synonymous. The topic sentence says, what is the answer? Okay. Hope that is clear.
Yes, Father.
This is it. You see, more and lowering elderly. What impact in the future? Speculation. Option C, yes. See, more interventionist. They take up of this more interventionist line of attack. GPs will adopt a more active approach. More interventionist line of attack, more active approach. Older, elderly, lower, lowering. As easy as that. Synonyms: older, elderly, lowering, lower. Synonymous language: active approach, greater take-up, discuss with their doctor. Yes. Reading part B, you can see even in B, you will see the same strategy. Okay. So please someone read these question stem, options, and first sentence.
What is correct about hypertension? Option A, for subjects with normal or subnormal hypertension, it can prevent or delay hypertension. Option B, BP can be well tackled with the use of BP-specific medicine. Option C, right changes in lifestyle can curtail down BP values more effectively than various other medical therapies. Paragraph, hypertension, prevention or treatment. Adequate changes in lifestyle are the cornerstone for the prevention and the treatment of hypertension.
Thank you.
Although,
So, thank you. First sentence, only one sentence. Question stem, what is the
Hypertension.
Correct.
About
About question
hypertension.
hypertension.
About hypertension. Okay.
Hypertension.
Now, first one, it can prevent or delay hypertension.
Tension.
Second one,
The specific medicine.
Use of specific
Specific
Yeah.
BP medicines.
BP specific medicine.
BP specific medicines.
Changes in
Changes in
lifestyle.
lifestyle.
Changes in
lifestyle.
lifestyle. Okay, now this is the first topic sentence. Can you find any similarity with any of the
Option C, Father.
options?
Answer C.
Option C.
Answer C.
Yeah.
C, Father.
Then you say this is difficult. OET is difficult. OET is cool. Option C says lifestyle changes can curtail down. Okay. Adequate lifestyle changes can are the cornerstone for the prevention and treatment of hypertension. First one, even otherwise, it is wrong. Why? It's speaking about hypertension. Hypertension, this one says, first option says grammatical mistake. I don't want to speak about that option now. That's entirely different strategy. Hypertension can prevent or delay hypertension. Second one is medicine. Third one is lifestyle. So, first one itself says adequate changes in lifestyle are the cornerstone for the prevention and treatment of hypertension. That is the topic sentence. That is the topic, which means change style. Changes in lifestyle. Just keep reading. Just see, lifestyle changes are fundamental for the therapy. Again, repeated. The same. According to the previous report, lowering effects over stable blood pressure and can prevalent monitor medicine. The weak point of the low level of compliance and it is assessed with necessary adequate changes in lifestyle would be effective. Again. And potentially it can, okay, adequate lifestyle can prevent or delay medical therapy. And more prevention, secondary medical, it can contribute to BP reduction. Okay, lifestyle changes in lifestyle can contribute to BP reduction and allow reduction of the number and doses of antihypertensive agents. Okay, then appropriate lifestyle changes. Changes in lifestyle would decrease other cardiovascular risk factors. See, every sentence repeatedly says lifestyle changes, lifestyle changes, lifestyle changes, lifestyle changes. And your hedging word is lifestyle changes in lifestyle here. And other one is medicine, other one is nonsense, and grammatically wrong option. So what difficulty you have, even without looking at the paragraph, first sentence itself, first topic sentence, you said this is the answer. Okay. How many times lifestyle changes repeated? Lifestyle changes. Saying that is the answer. That is the answer. This is from part B. Okay. It means lifestyle changes. Again, referent. Again, it means lifestyle changes. Referring to lifestyle. And again, here you have changes in lifestyle. How many times? 1, 2, 3, 4, 5, 6 times in this small paragraph says lifestyle changes is cornerstone, is foundation, can prevent, can help, can support. My goodness, so beautiful. OET is so interesting. No? Yes, Raquel, lifestyle. See, prevention, medicine, right changes in lifestyle concepts. Okay. Again, adequate changes in lifestyle are the cornerstone for the prevention and treatment of hypertension. Okay, for not only prevention, also for treatment. This is the structure, paragraph structure. This should be always in your mind, this triangle, upside triangle. As soon as you read, the first sentence is very important. Whatever type of question it is, the beginning of the paragraph or text is very, very important. So you see, question 7, answer option C, and topic sentence, they are same.